Welcome back to Wisconsin Tonight. September is National Ovarian Cancer Awareness Month.
And we've invited Dr. Ephraim Resnik, gynecologic oncologist from Columbia St. Mary's, to talk about symptoms and treatment. Thank you, Dr. Resnik, for being with us this evening.
Thank you, Carol.
First of all, tell us, what is ovarian cancer? What should people look out for?
Well, it's important to know, Carol, I think, that ovarian cancer, although not the most common cancer, in fact, only 1 out of 70 women will be at a risk of getting ovarian cancer in their lifetime. It is, though, the #1 killer compared to all other gynecological malignancies. It accounts for more deaths than all other cancers combined.
Are there, I'm sorry,
for the reproductive tract cancers.
Are there symptoms that the women should look for?
Well, I think it's an excellent question, and one has to understand that symptoms develop pretty late in the course of disease. Early on, they're very vague and very nonspecific, and sometimes people call it a silent killer, as you, Carol, mentioned off camera, precisely because there is no loud symptoms expressing it.
Now, Dr. Resnik, when you go about treating ovarian cancer, what do you do, and have there been any advancements recently that's making it better on patients?
Ovarian cancer treatment is very much specific to the stage of the disease. Early on in the course of the disease, surgery alone might be sufficient. Later in the course of the disease, combination therapy of chemotherapy, sometimes radiation, and definitely surgery plays a very important role in the treatment of this cancer. That's where it's absolutely crucial for the patient to go to the center that is specializing in treatment of ovarian cancer. It has been proven now in multiple studies there is a better chance for overall survival when a patient is treated by a team of the doctors who specialize and understand the disease itself.
Very interesting.
Now, your title is gynecologic oncologist, which is different than OB/GYN. Can you tell us about the differences?
Yes, of course. The gynecologic oncologist is a gynecologist who went on to train specifically in gynecological malignancies, studying both the advanced surgical techniques and chemotherapy and other modalities of treatment that are involved in treatment of the ovarian cancer. It's a team approach. It's not a single physician who's going to be curing the ovarian cancer. It's a highly sophisticated team of physicians, as for example we have it at St. Mary's, who specialize in treatment of ovarian cancer.
And women should look for warning signs, perhaps. What should women look for if they think they might be at risk for ovarian cancer, doctor?
Carol, as I mentioned before, the early on the symptoms are very vague and very nonspecific. Every woman, I'm sure, knows her own body, and she should be attuned to those very silent and vague symptoms that might not be what's ordinary for her. And if any of those come to the forefront, she should definitely bring it to the attention of her physician. And then the physician will take it on and start evaluating those symptoms.
Yeah, Dr. Resnik, thank you very much for coming in and spending some time answering our questions.
It's my pleasure. May I share with you some pins for ovarian cancer?
Oh, very much so. Thank you, sir.
Awareness.
Yes, and this is something that we can't talk enough about, because a lot of women, you don't want to wait too late. You've got to go right to the source and to the experts.
Yes, indeed.
Experts. So, Dr. Ephraim Resnik, thank you very much for being with us this evening.
Thank you so much.
Pleasure.
Appreciate it.